Welcome to another NCLEX Practice NCLEX Standalone Question Mastering. This is the NGN Gold information. So you will love to watch this video because this is our content, short form, straightforward, in a standalone form. So let's get to it. As usual, straightforward mastering, right? NS has attended staff education program on what? Cystic fibrosis. Select which finding the NS should recognize is consistent with this condition. You have to know cystic fibrosis to be able to answer the question. And this is the way to summarize content for you, right? Recurrent lung infection is common. They don't have borrowed chest. This is emphysema, so it's not consistent. They have thick mucoid sputum, right? You know the prescription for acetylcysteine. What is it for? Mucinous to break the thick secretion. The prescription for postural drainage. This is chest physiotherapy. So this is good. They have large, voluminous fatty diarrhea. So that is good. They will have growth retardation because they cannot absorb fat-soluble vitamins, right? And they cannot absorb food well. Most of them washed away. They can't digest their pancreatic and food that has a pancreatic content that may need to be digested. Yeah, they need a high calorie, high protein, but they don't need high carbohydrate diet because the pancreas is not working. It will lead to diabetes. So this is the trap. It's wrong. They need high calorie, high protein, high fat diet, but not high carbohydrate. Prescription for pancreolipase. This is to digest the fat soluble food ingredients. So this is what this little thing here has all the content you need for the NGN NCLEX. And this is the way I want you to think about NGN Gold. This is what it looked like. Okay. Next question. And this is provided teaching to a client with Parkinson disease. Select the teaching the next should include or not include. So what is the problem? They need a high fiber diet? Yes, they get constipation from all their prescription. Take shorter steps and swing the hand. This is what you tell them. They should wear non-skid shoes and then socks, right? They should prefer to use Velcro because their hand is shaking, right? Resting tremor. They should take small, frequent, but it should have high calorie because they will develop dysphagia. So this is good. They should remove all rags on the floor because then they will going to fall from it. And then install grab bar on the hallway or the stairs. It's a good thing for you. And then you should install elevated toilet seats because we don't want you to fall. This is designed to give you content that you need to know for Parkinson. This is what NGN Gold look like. And then it's provide discharge teaching to a client prescribed selectioning. Select the teaching the next should include or not include a discharge. So which one would the next talk about? Selectioning. You know, it's the MOI. Therefore, they should avoid thiamine food. Otherwise, they develop hypertensive urgency. They should also avoid other things that will increase their blood pressure. Nasal decongestant will increase your blood pressure, hypertensive urgency. You should not avoid rice and barley. This is not celiac, right? Like celiac disease, you should avoid broth and you should stay on the CRP, right? So this is not included. Prescription will take few weeks to work here. It does not work right away. You should avoid banana and avocado sandwich. Those contain a lot of thiamine. You can continue to enjoy pepperoni pizza. You should not do that because pepperoni has thiamine in it. Read food labels is a good thing for you, right? The food list provided is for liberalized approach. No, it's not for liberalized approach. I want you to stick to it for the rest of your life until while you're on the medication. So you should not include it. Adapt NCLEX NGN Gold Next Generation NCLEX way. And it's provide teaching, district teaching to a new mother about breastfeeding technique. Select the teaching the next should include or not include in a discharge. This is the way I do NGN Gold. Straightforward content. This is what so I take breastfeeding technique and I give you the content you need to know. What is the content? You should feed the baby 8 to 12 times a day. And I teach feeding, it should be what? Every other 2 to 3 hours, right? And when you feed them, every time 15 to 20 minutes. The baby should be touching your tummy and your tummy, tummy technique, right? You should what? The child should latch the breast and both areola. So the nipple, areola, you have to latch both of them, not just the nipple, right? They have to like be able to touch the areola, the black area, and then the nipple itself. Otherwise, you're going to cause problem. Use finger to break the suction after feeding, right? And keep baby body on the side. No, the baby body should align with you. That's why I call tummy to tummy. So this is wrong. Okay. I think we have one more questions. And then, and next as attended staff education program of cerclage. The and clinical application, which finding the nurse should recognize as being consistent with cerclage. So cerclage is usually used for patients who have had multiple miscarriages, especially during second trimester, and you want to prevent it. So what do? It's for cervical insufficiency. That's good. You involve suture ligation of the cervix. You're trying to close the cervix so that the baby does not come out. Removal of the sutures after second trimester. No, you're going to keep it until the end of the third trimester, close to 36 and 37. And then we don't want you to go to labor. So we admit you before, then we remove it. Suture check every month. Yeah, while you have it. Remove sutures before onset of labor. Excellent. Sex is allowed after suture placement. No. Pelvic rest. Indicate after first miscarriage. You don't need it the first miscarriage. You may need it later on, but not the first one. If you have 2, 3, 4 miscarriage, but the first miscarriage, we don't cerclage you, right? And this is the end of it. Thank you for watching Adapt NCLEX Way. If you need more, subscribe to our YouTube channel and get free videos like this, or join our membership and enjoy the NGN Gold, these short videos that I do for NGN Gold. Take care of yourself and have a great day. If you want more at YouTube, you can also join our on-demand at www.adaptnclassreview.com, and we have a live course. You may love it. Take care of yourself and all the best of luck stuff.